morning. This is the moment you've been waiting for. It is 28 minutes past 8 in the a.m. Now, I'm away from the smiling and laughing entirely, and I want to talk about issues that affect me as a woman and you as a person who wants to have a family, or somebody who's been trying to have a family, and a family for this particular generation and in this culture and in this setup is not a family until you have a child. That's what they have said for so many years. All right? So some people are wondering how it goes with the infertility journey. If you have been trying to get children for a while and there has been a delay, you're probably asking yourself questions. Or if you've been having stillbirths or miscarriages, you're probably questioning yourself in some way, and probably don't have the courage to go into a health facility. Maybe you've tried to talk to your husband or your spouse about it, and they really are not willing because they think there is a stigma around it. But I have decided to bring in an expert to the show for you. So just go to our Facebook page, KUTV Kenya. There's a live link there. You just stream there and give us your questions. I am sure Dr. Saudah is very free and open to answer some of the most common questions asked in regard to infertility. Also, I'm here to keep her in check and just to figure out if Kenya as a country is well equipped and the healthcare system is, credible enough to deal with infertility issues. All right, now she's here and I'm so glad that she is. Good morning.
Good morning, how are you?
I am so happy that you're here.
Thank you.
And you probably just want to introduce yourself again, because every time we see somebody in the hospital, we say doctor. You just want to give your credentials and of course connect to with the viewer at that level, because I know there's a way they talk to you when they come to you at the hospital. So just introduce yourself. Yeah.
So thank you, Ankey, first of all, for having me as your guest here today. I'm Dr. Saudah. I'm a gynecologist. So I did my undergraduate in Nairobi University. I graduated in 2010. And then from there, I went to Mo University, where I did my master's in reproductive health, which is also known as obstetrics and gynecology. And I graduated in 2017. Mm-hmm. So right now, I'm working at Nairobi West Hospital, and that's who I'm representing today.
Wow, nice. Ooh, okay, she made it clear that is who she's representing today. So, of course, you know where to find her after this particular interview. A lot of people are seeing you as a gynecologist and they're thinking, well, we want to talk about infertility, and this does affect men and women alike. So men are watching and they're thinking, if I do have an issue, am I going to approach her as a gynecologist?
Yes, definitely. You'll be surprised. 1/3 of the causes of infertility is actually due to issues with men. So, if they don't come forward, then we're going to have a global issue.
The men don't have issues with you examining them as a gynecologist?
Initially, maybe they get a bit skeptical, but then I do get quite a few men who come to my clinic.
All right.
Yes.
Do you also have couples that come?
Definitely. Mm-hmm. Not as many as I would like. I get a lot of single females coming in, but I do, and I must put it out there. There are a lot of men willing to support their women, and they do come in with their women.
I think times are changing.
Yes,
I think infertility in the modern times is giving us a different, perspective.
Definitely.
Now, you just mentioned a bit of the statistics, but I do want to give people, I gave them a bit of it as well earlier on, but I just want to give an overview, and I want to create a picture why this is very, very important for us to have this discussion this morning. When you look at the rates of infertility today compared to, I don't know, maybe years back, is it rising? Is it getting worse? Where are we standing as, as a country, as a generation?
So definitely, as you look over time, it is, some studies will say it's decreasing, some studies says it's increasing, but I think awareness is increasing. So maybe that is why the infertility in general is increasing, because now many people are, and then also we have a lot of people going for careers, and so we're delaying childbearing.
Okay.
Instead of having kids in our early 20s, we're starting to have them in our mid 30s, late 30s. So you see, that contributes a lot to infertility.
Wow.
Yeah.
And now that's it. We're going to talk about the causes in a bit, and I think we should just go straight to it, right? Because you've mentioned age.
Yes.
Which other causes, and just men and women, we want to tackle the women and then the men. Which are these causes of infertility? Because are we born infertile? Do we develop infertility? Which are the causes of infertility?
So that's a very good question. And usually age has a big role to play. For women more than 35 and men more than 40, it becomes a bit of a question. But mostly if we focus on the women, we contribute to about 30% of infertility. And the commonest cause is actually ovulatory dysfunction. So that is, our ovaries are not working that well. You've heard of polycystic ovarian syndrome and, issues related to the ovary. Then you have issues related to the tube. Then
fallopian tube?
Yes.
Okay.
Yes. And then you have issues related to the uterus itself. If the uterus, the shape is abnormal or it has a division inside the uterus. So you can get issues because of that. And then, of course, the cervix. So basically, the whole anatomy of the women, you can name each of that has a cause of infertility. And if you come to the men, mostly, and then for the women, I forgot to mention, very important hormonal. I think, and then we know that it's a very layman term. I have hormonal issues. It's a very broad term thrown out there so easily, but it's actually a very, deep reason for infertility. Okay, and then for the men, we do have hypogonadism or testicular issues, cancer, undescended testes. You have, the tubes where the sperm is supposed to come out from. If that gets blocked, the same as the women. So again, injury. And so it's so important when we're evaluating these patients to get a history from them.
Okay.
And profession also plays a very big role.
When you speak of injury in men,
yes,
what kind of injury are we talking about?
Okay, there are many types. There's some unknowingly that happen. For example, truck drivers. They don't know. They're sitting for so many hours on end, and that heat is not good for the testes. Okay? And then like football injuries or, anything that hit you in your crotch, it is very important to bring it out.
Now I understand why they're very protective.
Yes, they have to be.
When there is a battle around that area. And I want to talk about this is just for the common Mwananchi watching. I know you've mentioned the age. A lot of women feel that, because we've seen cases of women way older, way past menopause, highlighted in news, having twins. And it feels like, why do you then say age would contribute to my infertility, yet I've seen way older women have children at very, older ages. But men, as much as old as 40, 65, still have very young children. How are they able to sire them? This age thing. Are there exceptions, though? Okay,
so there are exceptions, and I will tell you, I have even patients in my clinic who come in at the age of 46, 47, and they're pregnant. They thought they couldn't get pregnant. So, they have the mistake child, or not mistake child, but the unplanned child, because you stop family planning and then you don't know. Some people are just lucky, I guess. They're pretty fertile, but that's a very small percentage. Okay, and then when you're seeing the women past menopause, you should always ask yourself, are they using their own eggs? Are they using donor eggs? So most of the time it's IVF, in vitro fertilization that they're using. And so you have to always, we don't want to give our youngsters a wrong, idea about it, that no, just keep delaying, you can get pregnant later. There are ways, definitely. But are you using your own eggs? Okay. Are you comfortable using somebody else's eggs?
All right, now these are things you need to start thinking of if you're trying to delay. Are you comfortable using someone else's eggs? We're going to come to that. But first, I know somebody's listening and they're thinking, what are the signs to look out for? Especially for us women, I think we've been told irregular menses, painful periods. I don't know about the men. You'll tell us that. But as a woman, what is it that I should check for? Maybe I'm just overthinking. What are these main signs to look out for to just know, hey, I think this is serious?
Okay, so it's a very tricky question because you don't want to start stressing out 15-year-olds. Go get yourself tested. But what I basically tell my patients is we will cross that bridge when we come to it.
Oh, okay.
If you're trying to conceive, so infertility is, the definition is if you've had continuous unprotected sex for up to 12 months without conceiving if you're less than 35, and less than 6 months, for 6 months and more if you're more than 35. You see how age comes in. So once you've reached there and then you're having issues getting pregnant, then you come look for one of us. That's when you get tested. It's not just a matter of, hey, I feel a headache. I feel personally, I do get people especially young girls who have polycystic ovarian syndrome, and they have a lot of hair and acne, and then they come, they're like, doc, what am I going to do? Will I have issues getting pregnant? So I told them, look, right now you've come to me with a different issue. You've come to me with your acne, with your hair growth, with your increased weight. So I will treat that for now. And when we come to because the treatment is different.
Okay.
I can't start treating your
Infertility,
infertility when you've come to me with a different, presentation.
Okay.
So we treat this now. When you're ready to get pregnant, you come back. We will manage it then.
I was asking these guys the big question today, and I'm just so glad. I'll read some of the feedback, because I was asking them, would you take a fertility test before marriage? And you're saying it's not just a test you take it when you are ready to have children. Amazing, isn't it?
Yeah, because it's just unnecessary stress, and stress will bring your fertility down.
Stress too can bring your fertility down.
It's one of, like I told you, 30% is women, 30% is men, 30% is mixed, both women and men, and unexplained. So unexplained infertility, we cannot find a reason.
Okay.
The woman is, everything is okay. The men, the tests are all normal. So the only significant test that you can do is actually for men, when you do a semi-analysis.
All right, okay.
To see if the sperms are okay. But for women, there's so many. Where do you start?
Nice. So let's talk about men. What do men look out for? I know women come with all the hairy problems and all that, but what do men look out for? And at what age do you start thinking, now this could be my issue as a man?
Well, especially if your partner has had kids before.
Oh, okay.
And you're having difficulty conceiving, then and then I tell my patients, mind is very important in infertility. I tell them, we're not looking to blame somebody. We're not. I don't want to tell you, oh, Ankey, it's your problem.
Yeah.
Or, oh, Stan, it's your problem. No. We have to look for a solution together.
Okay.
Yeah, so that's what I tell them, that we're not looking to blame you. We need to do your test so we know where to help you.
Nice.
So for men, well, there's no, sign as such to look out for. Because for men, they're lucky. They can even have babies up to the age of 70.
Yes.
If they have good sperms, all we need is one sperm.
Oh, yeah. Oh, okay. There we go. They usually say that you are a winner, you are a hero, you're a champion for a reason. You are the sperm that was able to ovulate that egg, to fertilize that egg, something like that. So all of you are heroes this morning. If you're watching, kudos, all right? Just one sperm. All right, now, of course, people are talking about this treatment, though. I know one thing I want to ask later on is the expenses and how costly it is. But before I get there, what are they? Because I'm sure people are like, are we going through those radiations? And even before we go into the treatment, the tests.
Yes. I think the tests.
Yeah.
So before we get to the test, there's one point I would like to make. There was a study that was done in Kenya, and they actually found that most of the infertility, especially secondary infertility, which means you've had a baby or a miscarriage before and now you're having issues conceiving, is because of blocked tubes.
Okay.
And the reason for that, and why I'm using this opportunity, is to get it out there. We have a lot of youngsters who are going to the backside doors for, abortions, and all these can cause infection. They don't realize it then. They come to us 5 to 10 years later. The tubes are blocked. So blocked tubes are actually one of the commonest causes of infertility when it's the women's side contributing. Okay. So it's very important. So that leads me to one of the tests. It's called an HSG.
Okay.
A hysterosalpingogram. So it has radiation. It is a painful test.
It is painful?
It is a painful test.
Okay.
Yeah, but especially for patients with secondary infertility, it is one of the first ones we go to.
Okay.
Yes.
Wow. All right. So that it does apply for both men and women?
No, it's mostly for women. For men, we do the semi-analysis.
Like you said earlier, yeah.
Yes,
all right,
the sperm test.
Is it affordable though? Because I'm sure there's a couple watching and saying Nairobi West.
Yeah, well, the HSG is, I guess, pretty affordable. I think it's about 6,500, depending, 4,000 to 6,500 in wherever you're going. And then the good thing is NHIF pays for it.
Oh, so the insurance can work?
Yes.
Great.
Yes,
good. So then any couple that is dealing with this kind of questions today can just walk in and use your insurance card if you do have that cover. And a lot of questions, of course, people are asking, how many times can you get treatment? How many times is too much?
Tested or treatment?
Treatment.
Treatment.
After you have done your first treatment,
yes,
and you probably feel it wasn't enough. Can you keep going?
So it's like an illness.
Okay.
If you have malaria, I'm gonna hit you with anti-malarials until you get better.
Okay.
Right. So the same thing. It's infertility. I wouldn't say an illness, but it's a condition we're treating.
Yeah.
So it depends on the treatment. Of course, there's medication. I mean, if you want to talk about that, we can try with ovulation induction. We can give you medication, and if that fails, there is other options like, IUI, IVF, which is in vitro fertilization. I think a lot of people out there know about it, and so it's very costly.
It is costly. So
it depends on your pocket. How much do you want to keep going?
All right. Some people I know are winking at you like, hey, can you see me? Can we talk about the pocket idea? Also, I know there's a question of, after I get treatment and I get my first child, is there a possibility that even after having my first child, I could be infertile again? Can it recur?
Well,
or it is a permanent solution?
Not really a permanent solution. So not that if you get IVF once and then you're just gonna have babies thereafter.
Yeah, no.
It, like for example, blocked tubes. There's no treatment for that. So you have to do IVF every single time.
All right.
Yeah.
Now I hope somebody has gotten that clear. There was a lady who sent in a question, and she says, ask her about yeast infections on women and those contraceptives that tamper with periods, whether they can cause infertility.
Well, I can attack the family planning question first.
Yeah.
So we have the hormonal family planning methods, right? So for example, the implant that goes for 3 to 5 years, and the depot injection that goes every 3 months. So they don't cause infertility as such, but they delay your return to fertility.
Okay.
So it can take about 6 months to 1 month after stopping or removing the implant for you to go back to your pre-family planning fertility.
All right.
Yes.
So they do not cause infertility. They kind of keep you on hold for a while. It takes a while to recover, to bring it back.
And then another point, you see, when you're using the long-term family planning methods, you have to consider age.
Okay.
You're not as fertile as you are when you put it in.
Nice.
Yes.
I think that is very, very important. I want to look at the feedback. If there are any questions on the feedback section, I know we want to talk about more, and we can never emphasize, cover this entirely. Let's see what people are asking here real quick. And of course, they're really watching. Ladies, do you have any questions? I'm sorry, I have to really scroll through. Someone says, that is JC Simon saying the old team well represented, Dr. Saudah. I don't know if you know JC Simon. Just saying Dr. Saudah represented. Okay. Pooja Braganza says, waiting for Saudah Farooqui. We are proud of you.
Oh, thank you.
All right. So a lot of people are just, saying they're glad you're here. Saeed Fahid Hussein says, sent Dr. Farooqui. I came online from India to see her.
Wow, thank you.
Yeah. Someone says, this is Lubna Farooqui. I hope I'm pronouncing that correctly. Says, proud to have sister like you. Love you. Okay.
I think my family's gone nuts.
I think your family is really here. Hamad Assad says, my sister. Asma Hussein says, this is Asma Kalajan. Here, love you, very, very proud of you. Hisham Assad says, my sister from the same grandmother.
That's my line. He's stolen my line.
Don't I have my family watching?
Yes, I think the whole family is watching from all over.
Please say hi to my sister, Shiko Kiarie.
Hi, Shiko.
And say hi to my sister, Angel Kaden.
Angel Kaden, how are you?
I have a brother called Boniface Otieno.
Oh, wow. Boniface, how are you doing?
All right, now as we wrap up on the infertility, case, I know that a lot of Kenyans are therefore asking, do you feel that men should be encouraged to come out more, because we have history of being raised culturally in a way that men have really been able to hide under their ego skins, as as a person in your office. And sometimes I think you get the stigma of, hey, you're a woman. So what would you say to the couple watching and to the men watching, and how to be supportive in this journey of infertility?
So definitely we want the men to come in, and I think because Nairobi is it's a capital city, and because it is so cosmopolitan and we have a lot of awareness here, I do get a lot of couples coming in. And when they come in as a couple, they really me being a female is actually a good thing for them. It helps me connect with because usually I think it's us women who suffer really emotionally. Okay. So I feel like we're able to connect one-on-one better. And so they do come in, but to those men who don't, there are some men who even fear semen analysis. It's just a test.
It's just a test.
It's just a test. And we are not looking to blame you. We are not looking. It does not say anything about your manhood, that you're not man enough. It does not. It's just to help us build your family and help you bond with your partner even more. So please come in. You know, I know there's a stigma around it.
Yes.
And the men say, there are so many men, they say we can't be the problem.
Oh.
And even if they have had other children, and I mean, I'm sorry to say this on live TV, but women do lie.
Okay.
Okay.
All right. That was just the bombshell right on the WCW edition. And I want to appreciate you today for being here. I know we are running out of time. She is married to an amazing man. They don't have children yet.
Yes.
Walking this journey, and there could be a delay, but the courage to be working with these other people as well. I think, bravo.
Thank you.
Thank you for being bold.
Thank you.
We're looking forward to, having you again for more discussions on this. I know guys are like, we wanted to ask more questions, but we have to wrap up, bringing a psychologist on board, a man actually. And one angel was asking, how much approximately is the test?
Which test?
The women fertility test.
The HSG?
Yes.
It's about 4,000 to 6,500. But that's there's so many other tests, hormonal tests that we need to do, and it can be costly. But the good thing is, if you, like for example, the Nairobi West Hospital, it has NHIF accreditation. So you come in, everything is paid. And I mean, we have an infertility center, an infertility specialist, so you guys are more than welcome.
And one of them is right here. So guys, I can guarantee you that the Kenyan system seems like it is working on making sure that we all have this journey with our medical experts. So we're just gonna have your social media handles and follow her, look for her, and very easily just go to Nairobi West and look for Sarah, Dr. Sarah Farooqui. Saudi Farooqui. Pardon me. So what are your social media handles as they start following you and asking you questions?
Okay, so my Instagram is dr.saudah.farooqui. As simple as that. Yes.
So they should find you more on Instagram?
Yes.
Wow, you guys. All right, that's it. Thank you so much for coming through.
Thank you
for answering our question. Would you take a fertility test before marriage? You said it's not necessary.
Well, for men.
And for men.
Because for women, there's so many. Where do you start?
Yeah, okay. All right, men, you had that. Allow me to take the short break. I'll be back with a psychologist, Alan Lawrence, who will let us know how men perceive this, how women perceive this. And I just really want to ask more questions related to men, because we need a man to speak for men. And if you're dealing with some psychological problems, how to deal with it, how to walk that psychological journey with your partner in just but a bit. Thank you for watching. And Farooqui